Good morning, everyone. This is Crystal with Catching Up with Crystal, here to do a review on Ozempic. For those of you who are interested, Ozempic is a medication that you take once per week. It's an injection. It doesn't hurt. The needle is very small. We'll go over that. Ozempic is used for the treatment of type 2 diabetes, and it's also can be used for weight loss. However, if their treatment really is for type 2 diabetes, and then weight loss is a potential benefit of being on Ozempic long term, that with diet and exercise will produce the weight loss. So Ozempic is on the market. It's been on the market a little bit now. And like I said, it's for type 2 diabetes. Your doctor is the one who has to prescribe it, or a nurse practitioner or a physician assistant. And so type 2 diabetes is a disease where you are still making your own insulin. Now, Ozempic is not insulin. It comes in a needle. We'll go through that, but it's not insulin. Type 1 diabetics don't produce insulin generally. Type 2 diabetics, we still produce enough insulin in our bodies. However, it's not enough to bring the blood sugars down. So what happens is, and I don't want this to turn into a video about diabetes. I'll make another one just focusing on diabetes for those who are interested in the future. But so what happens with diabetes is we eat. Insulin is a hormone that unlocks the key to our cells so that the food that we eat, which is then converted into, let's say, sugar, basically, or energy, because we don't produce enough of the insulin to open up our cells so that the cells can receive the benefit of the sugars or glucose in our blood system. It can't get into our cells to energize us. What happens is the sugar stays in our blood system and it just floats around. Then we gain weight, we store fat, usually in our bellies and hips, and that's a whole nother video. But this is a review about Ozempic, and I apologize for going off track because I'm already 2 minutes into this video and I haven't gotten to the nitty gritty. So what happens is Ozempic comes in milligrams of 0.25, 0.5 milligrams, 1 milligram, and 2 milligram. So you would start off at 0.25 generally. That's the starting dose. That's to give your body a chance to adjust to taking the medication. Now, you inject it once a week, and then if you tolerate it, after 4 weeks, then your doctor will go up if you need it, if your blood sugars are not responding. However, she'll go up, or he'll go up to 0.5, and then 1 milligram, and then 2 if your doctor says that you need it. However, everybody will not be on the same milligrams because everybody's diabetes is different. Some people are newly diagnosed diabetics, and some people have been diabetic for a while. And so your doctor may put you on Ozempic. Okay, so I just want to go over some of the side effects that can happen with Ozempic. One of the side effects that a lot of people complain of is nausea. And so what can happen there is, so one of the ways that Ozempic works is it slows down how the food moves through your system through GI. I don't want this to turn into like a whole medical lecture. I want to keep it simple and quick for those who just want to know how Ozempic, how to shoot the pen. Okay. But anyway, it slows down the motility in your system, so the food stays in your body longer, and so you feel full longer, and so that's what happens. And for some people, because they feel full longer, they have a sensation of being nauseous. So that's what's happened. Another one might be constipation, because again, the food is moving slower through your body, and then you aren't pooping as much as you used to because the body is moving slower. The food's moving slower through your body. Okay. One of the other potential things for some people, it can lower your blood sugar. So you want to be mindful of that. If you're already at risk for getting high blood sugars, if you take Ozempic with another medication, this can increase your risk for blood sugar. You want to definitely let your doctor know about that. But the most common side effects are nausea, diarrhea for some people, abdominal pain, and constipation. So let's get that out the way. And I'm sorry I talked so long, but I hope that was useful for some people. Okay, so this is the box of Ozempic. And so I'm going to open the box. Okay. Ozempic, it has the directions. I hope you can see it right there. Okay. It just says read the label and make sure that the Ozempic medicine in your pen is clear and colorless. So I'm opening up. It comes with an insert that tells you all about the medication. I'm going slow. I already know how to use it, but I'm going slow for those who are paying attention to my video. It comes with a pen. So this is the pen. No matter what milligram your doctor prescribes, whether it's 0.5, if it's 0.5 or 0.5 if it's 0.25 or 0.5 milligrams, the pen is going to be a different color. And the reason it's going to be a different color is when you get the medication, you are going to have to dial it up. So if you can see that's at 0 now, you would have to dial it up to 0.25 or 0.5 milligrams. If you're on 1 milligram, you will dial it up to 1 milligram. If you're on 2 milligrams, it's going to be a different pen. Okay, so this is the pen, and it has all the medication that you already need in it. Pops off just like a pen. The Ozempic should be clear. Can you see that? Shouldn't be anything floating in it. Shouldn't be yellow or cloudy. It should be clear. Okay, that's the pen. That's the dosage where you dial it up. Okay, I'm going to put this down for a minute. Also included in your package of Ozempic, what will come in your box of Ozempic are your needles. Okay. Check and make sure that the expiration date is good. And mine is good. This is 2026, so we're good. So we are going to open the needles box. I'm not good at opening anything. I'm a terrible Christmas box opener because I just rip it off. I don't recycle my Christmas wrapping paper. Okay, so it comes with these little pre-packaged sterile needles. Okay, they're sealed, and you just pull the plastic back. Can you see that there's a tiny needle in there? Okay, little tiny needle with a cap on it. What you're going to do is you're going to take your Ozempic pen and you're going to connect it and screws on. The needle screws on. Okay, and then it's tight. I took the lid off and there's a needle. Let me see if I can make it so you can see it. There's another safety cap. So when you get it, it's going to be 2 caps on here. The first cap from the pen you take off. Then you're going to see another safety needle. Okay. Take that off. See that pen? See that little needle? It's so thin. Even if you're the biggest baby, you'll see it. Okay. All right. I'm going to dial in. I'm going to put my top back on just for video purposes. I'm going to dial my dosage, which is going to be 1 milligrams. So if you were doing 0.25, you hear that click? If you wanted 0.25, this, you would start to see little lines first in this window. That's your dosage window. And then you would begin to see numbers. And if you wanted 0.25, you would stop at the 0.25. If you wanted 0.5, you would stop at 0.5. However, this is only for 1 milligrams. Okay, so you're going to start to see the 1 milligram come up. This is a 1 milligram pen. And you hear that clicking? Okay. Do you see now I have a 1? Can you see that? It's upside down. There you go. You see the 1 milligram? Okay. Now, you do not have to have alcohol available. If you do, that's beautiful. If you don't, soap and water works fine. You just want to clean the area where you're going to inject. Also, rotate your injection sites. Don't inject in the same spot every time because you can get sore there. You could build up calluses and scar tissue there, which would make it more painful and difficult the next time. Don't reuse these needles. They come with about 5 needles in the box. That's going to be more than enough for you. 1 needle will last you a month generally. So there's enough brand new needles in your box for you to use a different needle with each injection. Okay. And I believe I usually end up with 1 extra for some reason. It might have been the way I started. Okay. I'm going to use alcohol. Now, the kind of injection you're going to give is called a subcutaneous injection. So this needle is very skinny. I'm going to stand up so you can see as I do. You want to grab some belly fat. And you want to have enough fat between your skin. If you're not a fat person and you're diabetic, just grab as much fat as you can. The abdomen is a good place to work from. You can get a decent amount of fat there. That's where I'm going to get mine from. Okay. See that belly fat? And what I'm doing is I'm going in a circle, because I'm going to clean not only the site that I'm going to inject, but I'm going to also clean the area around the area that I'm going to inject. I always let mine air dry a little bit. Okay. I'm going to let go of it just for you guys. I'm going to take the pen off. Pops right off. Can you see it? See how little that is? Even for my big babies. I'm going to grab back my injection site. Okay, this is a plunger on the end. When you go to inject, you're going to stick the needle into your abdomen and you're going to inject. Okay, this is going to go down and you're going to hear some clicking noises. And when it's done injecting all the medicine, it will click. So here we go. Little stick, 1, 2, 3. I don't even feel it. I'm pushing the plunger. This is the plunger. Push and hold it all the way down. Did you hear that click? And the reason I'm still holding the needle in my belly is because you will notice even after I take it out, there might be a drop of the Ozempic on my tip of my needle, and that's fine. That's normal. But you want to leave the needle in. Count, give yourself a good count, slow to 10. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi, 7 Mississippi, 8 Mississippi, 9 Mississippi, 10 Mississippi. Pull the needle out. Release. Now, can you see? I don't know if you can see it. That there's a little drop of the medication. Can you see it? That's always going to happen. Okay. Now, you're never supposed to recap needles if they're not, if you injected somebody else. Never recap a needle because you could get stuck. You don't know if somebody else got hepatitis or whatever. Don't recap a needle. However, this is my own body, so I put the top back on. and I screw it off the needle. Okay. That's what it looks like with no needle. Should be clear. And also, after I've injected, did you see it went from 1 to 0? Okay. All right. So you want to dispose of your needle. Don't throw your needle in the trash so that somebody else could get stuck with it. That's not fair. If you have an old coffee can or an old canister, something with a top on it, the needle is very little, and it can go in the trash safely if you contain it. All right. So that is my review and how to inject Ozempic. I do want to say, did I lose weight with Ozempic? I did lose weight with Ozempic when I first started taking Ozempic. Now, it's not going to be a huge amount of weight. You're not going to be, you know, like I'm going to get my beach body or my bikini body, or, you know, I'm going to be looking fly this summer because I'm on Ozempic. It works with diet and exercise. And again, how it works is it helps to lower our blood sugar so that our body can utilize the energy that when we eat. And with diet and exercise, you can lose weight with Ozempic in the long term. This is Catching Up with Crystal. Life is what you make it, so make the most out of life. Please like and subscribe to my videos. I'm a nurse practitioner as well as someone who loves to travel. Stay tuned for other videos. Like and subscribe. Ring that bell notification so you'll know when I'm posting new content. Sorry about that. New content. Good luck. If you like my review of Ozempic and you'd like to see other things reviewed in the medical field, let me know, and we'll make it happen. Stay blessed.